Good morning, afternoon, and evening, everyone. I know some of you are joining us actually from different countries, and I want to thank you for that. It must be either really, really late for you, in the middle of the night for you, or early, early in the morning. So thank you for joining us today for the End Brain Cancer Initiative's Caregivers, Self-Care, and Tools webinar. And this is our series number 2 this year. This webinar is focused on caregivers, helping them with tools that will help their job as a caregiver, I hope, be easier. And we want to let them know that we see them and we understand how difficult and how hard a caregiving role can be and is. And we want to help you if we possibly can. Today's webinar is focused on financial toxicity with the idea of how do you escape financial toxicity with a oncology or a neuro-oncology diagnosis. So today we're going to be able to give you some resources and some tools related to this. And we know that it's published that financial toxicity is tied to the increased risk of mortality among patients with cancer. So, if we can address that issue and talk openly about it and provide resources, we hope that we can decrease the amount of financial toxicity that people will experience with a cancer diagnosis. And we hope that we will increase their quality of life as well as their survivorship. I'm Dellann Elliott Mydland, and I am the co-founder of the End Brain Cancer Initiative. My late husband, Chris, and I actually founded the organization, which you all used to know as the Chris Elliott Fund, over 23 years ago. And our whole purpose for founding the organization was to really help patients and caregivers almost know what they needed to know before they were diagnosed with a brain tumor or brain cancer or metastasized disease to the brain. And we still are pretty solid with that goal today. So thank you everyone for joining us. My contact information is right in front of you. If you ever have a question, a concern, need a resource whatsoever, just want to talk, you can always get a hold of me. Please know that. When we do our patient disease educational webinars and events, we look to industry to help fund that effort. It actually takes quite a great deal of money to create and constantly update patient and caregiver disease education programming. And so for this particular series, our longtime industry sponsor is NovoCure. And we want to say thank you so much, NovoCure. We genuinely appreciate our partnership. You allow us to do so much that we would not be able to do without your support. You also allow us to increase the patient disease education awareness and outreach, all of the disease education creation through fact sheets, through videos like this one, through webinars, through the information that we're able to put up on our website. We're able to get that out in a big way, thanks to our individual donors, as well as our industry supporters, as well as support from supporting sponsors such as Great Purpose Productions and WIM Social. So thank you very much. So today, we are actually going to hit on some really important topics. We're going to talk about caregiving lessons learned and paying it forward from a past caregiver, Bryan. We're also going to learn, believe it or not, how to improve access to TTF fields, which is TTF treatment, and to the caregiver and patient community. So TTF fields in the space in brain cancer is not only FDA approved, but it is part of standard of care. And so improving access to standard of care and to others who are also potentially using Optune Gio or TTF fields, that's what we hope to be able to achieve today. We're also going to be looking at navigating the costs of care and what financial toxicity is. And I can't wait to bring you our keynote speaker, Aimee, to talk about that a little bit later. We're also going to cover Insurance 101 and resources for out-of-pocket expenses. We're going to do that with Jen Natola, and we'll do that a little bit later. Jen has also joined the team for the In Brain Cancer Initiative, and we're excited to have her as part of our mission team. Thank you, Jen. And lastly, we will, again, as we always do, we will cover some of our patient and caregiver and clinical trial navigation services with our patient navigator and clinical trial coordinator, Shreya Prakash. So I think we should hit it, right? Now, none of this gets done without a big team behind me, right? So what you're looking at is our mission team. This is our daily mission team, folks. These are the folks who drive awareness and outreach. These are the people who work one-on-one with patients and caregivers and families and healthcare providers and researchers. These are the people that are behind the In Brain Cancer Initiative's day-to-day work, our programs, our services, and our mission. Thank you, mission team. And behind our mission team is an awesome group of folks. We call them our medical advisory board. Some of you will know some of those people in the photos. Those are some of the top professionals in the field of brain tumors and brain cancer working in the United States. We are able to refer people to these folks and get them in very quickly to these specialists. And all of these specialists that you see right in front of you, they are research specialists. They are research specialists in the neuro-oncology field. So when I say research, translate that to advanced treatments, advanced diagnostics, advanced devices, and clinical trials. And so these are the people we lean on a daily basis if we don't know how best to help a patient or their caregiver. We've got a whole group of support behind us, which is our medical advisory board. And we are thankful to them every single day. They work very hard, not only for all of you patients and caregivers and families, but also for the In Brain Cancer Initiative. Thank you. So our mission statement is kind of long, even though we have rewritten it, but it's really important. I mentioned that we've been around for over 23 years, and our mission statement hasn't changed very much. At the core, it still means the same thing. So we are a 501c3 nonprofit patient advocacy organization, and we're focused on disease education, awareness, outreach, and increasing patient access, and in doing so, improving standard of care. So, as I mentioned, we used to be known as the Chris Elliott Fund, CEF, and we are dedicated to ensuring that all patients diagnosed with brain tumor, brain cancer, metastasized disease have equal access to advanced treatments, diagnostics, specialists, and clinical trial participation. We believe that immediate access to these options provides this patient community with the best hope for survival and sustained quality of life. In order to do this, we partner with patients, we partner with industry, we partner with researchers, we partner with other advocacy groups and medical teams and hospital networks and others to educate patients and their caregivers so that they can have empowered conversations with their own medical teams in order to increase their patient options. That's what we do. It's a lot, I know. But we meet our mission through 3 distinct programs and services. And these pretty much haven't gone away. These have pretty much been in place, honestly, for 23 and a half years. We didn't always know what to call these programs, to be honest. We were just sort of delivering and doing it, but now we call them this. Our first program is our Patient Disease Education, Awareness, and Outreach program. It's very large. And our next program is really a services program, and that's our Direct Connect program. That's where you get to work with our patient navigator and our clinical trial coordinator. And we get to not only educate you about all things brain tumors and brain cancer and metastasized disease, but we're really listening to you and trying to learn from you during our formal intake process what your brain tumor journey has been like so far, And are you working with a specialist? Are you working at a center of excellence? And if not, we can get you in. And we also want to help educate you about advanced diagnostics and devices that you maybe haven't been exposed to, including clinical trials and why some of them will make scientific sense specifically for you and for your tumor, your brain tumor tissue, and your molecular and biomarker parts of your brain tissue. So make no mistake, when we say even GBM, it's not one disease, it's multiple diseases. And therefore, you have to have your tumor tissue tested so that we can figure out what those markers are of your brain tumor so that we can get you into the treatment that's going to target the markers within your brain tumor tissue. And then our third program is a lot. We just sort of throw everything else into advocacy and key opinion leader programming. So we're lucky enough to have been around enough where the In-Brain Cancer Initiative is actually looked as a key opinion leader in this field. And we're happy to be there at the table all the time. And on the advocacy side, we're always advocating testimonies, speaking, writing letters of support for research. And we work very, very hard with the FDA and with industry to get treatment options approved so that you will have access to them. We also work really hard behind the scenes on the reimbursement process so that that also increases access to advanced treatments and diagnostics and clinical trials. So that's what we do in that advocacy and key opinion leader programming. So during this program, you're going to hear probably about 3 separate times a shout out, a call to action that if you can support our work, send a donation. There's a lot of work that we do. All of our work is free to patients and caregivers and families. We intend to keep it free, but we have to have support. There's a couple of different ways you can support the In-Brain Cancer Initiative. You can literally take your phone, point it to the QR code, and it'll take you directly to our donation page on our website. You can go to our donation page on our website, inbraincancer.org. You can even text EBCI 244321. And we always say if there's any way you can make a $50 donation, that will cover one patient or one caregiver. It will cover an hour of them to be able to meet directly with our patient navigator and clinical trial coordinator. So all of it really, really helps us stay in business because make no mistake, even though we're a 501c3, we are actually a business. There are actual taxes that we pay. We pay rent. We pay all of our insurance liabilities. We pay all those things like a regular business would. So I just wanted to hit you up on that. Thank you so much. Our first speaker today is Bryan Blondeau. And Bryan, I've known Bryan for a very, very long time. And it's great today because he's going to be speaking about not only his personal caregiving experience and lessons learned during that experience, but also lessons learned as he's had time now to reflect back on his caregiving experience. So, Bryan, I'm going to read your bio if I may. And then
Yes, please.
we'll jump right into hearing from you.
Thank you.
Bryan is a caregiver. He was a caregiver for his mother during her glioblastoma journey. During that year, Bryan recognized clearly the teamwork that was going to be critical to give his mom the best chance to live a comfortable life with the hope of beating all the odds every step of the way. During his presentation, Bryan will share the story of his caregiving journey, how EBCI was able to help, and the important lessons he learned along the way. We are proud to welcome Bryan to the In-Brain Cancer Initiative team as one of our ambassadors. Thank you, Bryan. Thank you for being here, and thank you for sharing.
It's really nice to be here. I want to start just by saying I saw that my email is there on the very first slide. I want everyone to feel free to contact me, and I'll go straight to Dellann and her team. But I would also be glad to just receive any input or questions about my presentation. Thanks for putting that together. So again, my name is Bryan Blondeau. I was in my mid 40s when my mom was diagnosed in February of 2015. And I want to bring up what I'm doing right now just as a homage to my mom. My mom was very much an outdoors person, very active, really, really loved nature and loved to include other people. And so at this moment, I'm actually on the west coast of the United States, enjoying the redwoods and enjoying the kind of nature that my mom appreciated and also handed off to me, the love of nature. So it's really nice to be out here and to share her story. I'm sure she'd appreciate that I'm able to share her story with you all and maybe offer a little bit of guidance of kind of how the caregiving journey can be very successful. This first slide, I want to mention, it ties into the next slide, which says the need for teamwork. But this first slide is really significant because you can see that there are a lot of people involved with caregiving. This is pictures of friends and family, all who gathered together and shared information almost on a daily basis for the entire year that my mom was getting treatment and learning about this disease. So that's a really nice slide. Really shows that everybody, including my mom, is smiling. We're all together and we're figuring things out together. That is what happened every day. What I would like to prioritize is this idea of teamwork. When we first heard about the diagnosis, I think I can tell you very sincerely that almost all of us, let's say about 30 or 40 or 50 people who deeply cared about my mom, had a different idea of what direction we should go when we heard about this. And that's why I wrote this short list of 7 bullet points to kind of talk a little bit about some of the things that came up. Before I start into this list, I want to, if anybody wants to jump in on this call and just ask for clarification at any time, please jump in. I certainly am more comfortable with a conversation than I am with just talking, but I'll be glad to continue on.
Bryan,
Mhm.
Bryan, sorry to interrupt. I apologize.
No, it's not an interruption.
Also, if you do have a question and you want to just put it in the chat, please feel free to do so as well. I am watching those and monitoring them. And if you see them, Bryan, you can address them. And if not, I will point them out to you.
That's a great idea, Dellann. Okay, so like I said, about 40 or 50 very close people almost immediately were ready to go on their own individual tracks about how to help my mom. And some of the most, of course, the most common question is, what is this? Is this for real? Is this true? Are we sure? And those are my first 2 points. I am a logistics person, and my nature was to find out the answers to these questions right away. Whereas other parts of my family and very, very caring parts of our community were very emotionally affected immediately and wanted to come over and wanted to visit and wanted to care and wanted to hug. And we needed all of these skills. What our family did was we leaned into our general practitioner at the time. And we found out maybe about a month or two into the challenge that our practitioners were not part of an expert brain cancer center. And so when we get to point 3 there, I written where do we reach out now to get the most accurate information the quickest? This was not possible for us because our general practitioner in the local healthcare system were not actually experienced with brain cancer. In my search for answers, I did a internet search, which most of us will do, and that is initially how I found EBCI. It was through a internet search. I'm going to go down to point 4. How will I gather the information I learn and share it with people who want to help, follow, know more, adjust, improve, and be creative in care? Once I found EBCI, there was so much to pass on to all the caregivers that I really needed a system that I could share with people besides email, besides phone calls. And that's why I've written that down, that's one of the characteristics we had learned, that once a really interesting and useful information started coming in, how do we spread it around to all these caregivers? This is one of our biggest challenges. And number 5, where can I find information to give friends and family so we can each research at our own pace and at our own comfort level? Once I started to distribute the information to everybody, I quickly learned that everyone had a different pace about how they wanted to read, how they wanted to listen, how they wanted to feedback. Some people wanted to talk immediately with solutions. Other people needed the night. Other people needed the weekend. All of them very legitimate responses, and all of their reactions once they got in their comfort level were very needed and very welcomed. So this is a characteristic that I noticed as well. Number 6, the majority of us wanted to know, who are the experts? Where are they located? How can we reach them like now? Do those experts fit in with our personalities? This is where EBCI really, really helped as well. They were able to steer me towards an expert location, and then we could do a little bit of investigation whether the personalities matched who we were and who my mom was. And number 7, I put, who are my partners in this challenge coming up? I'd written here, partners who align with our lifestyle, are calm, inclusive, kind, considerate, thorough, curious. They love life, deeply care, and are ready to act now. I can tell you that when I read these characteristics of the partners who helped us through, all those characteristics are my mom. And I think that's how we came up with these descriptors. This is the kind of person she was, and the kind of people that we wanted to work with had the same characteristics as her and the rest of our family. So that's my slide about teamwork. I'm open to any question about that, but I wanted to just talk about how important that was to us. I can remember the day that I found Dellann and her team. I remember I was sitting at a picnic table similar that I'm sitting right now, and I found them and they answered the phone. And that was fantastic that they answered the phone. And I didn't have to talk but 2 minutes, and they knew exactly what I needed. That was such a breath of fresh air. And you can see here in my list, Dellann and her team immediately were able to tell me where I could go for help, like solid help. They were able to give me contact lists and the phone numbers and the emails that I needed. They actually told me what to ask them, who to ask for. That really saved me a lot of time and a lot of heartache. And number 4 point there is one of the characteristics I remember the most sitting at that picnic table is they really understood where I was coming from. That gave me a calmness and a confidence that I could pass on what they're saying to me to the other caregivers. It was priceless. And the last point I have there is I got the feeling that Dellann and her team were willing to do anything they could to help me, and I really mean anything. And one of the things I remember the most is that they offered me to come by their office anytime I wanted to, or they even offered to come out and visit us if we needed that. So that kind of immediate response and inclusion was really, really helpful. And so that's my slide on EBCI. Now
Thank you
we're
so much, Bryan. Really appreciate that. Thank you. Okay, so what are those lessons learned?
You just mentioned that I've lived another 10 years since my mom passed away, and you mentioned that I learned a lot over the years. I've actually followed a lot of the support groups that are out there for brain cancer. And there's a lot of really, really well-meaning, really, really good groups. But I have not found a group that prioritizes getting these very, very succinct answers as quickly as possible, as well as EBCI has done. I think my first point there is talking to somebody before choosing a doctor is just significant, very, very important. I think most of us, our nature is to go to the doctor that we know, someone that we've already met, someone that we're comfortable with. If I think back on it, the best thing for us would have been to find a doctor who's an expert in brain cancer before we started having the difficult conversations. That would have helped us a lot.
Bryan, can I interrupt you for a second?
Not anytime.
Thank you for sharing that with people, because that's super, super important. Is you really want to be working with the best of the best within this disease, within brain tumors and brain cancer and metastasized disease to the brain. And when we say doctors, we not only mean neuro-oncologists, but we also mean neurosurgeons. We want to make sure that if you are having surgery, you are working with a specialist, working with a neurosurgeon who performs brain cancer, brain tumor resections, pretty much on a daily basis, and is very interested in research,
Yes.
right? I just wanted to add that.
I appreciate you adding anything, Dellann. I completely agree. It's one of the more difficult things to do, to look back and think about what you could have done. But I'm very privileged to be able to do this and talk about this way. If I can steer anybody in the right direction from the very beginning, I know that the journey is much, much more comfortable and much easier to understand if you can do it that way. I'm looking at all my lessons learned. I think I'd be best to sum it up. Getting the right partners from the beginning is one of the biggest steps you'll ever take. And I can't really describe how difficult that is to do when your heart is breaking and you're in shock. But I believe that EBCI, the way that you talk to people, the way that you verbalize all your experience, you're very, very approachable. And I want to say that I want to kind of integrate that into my lesson learned, that even in your worst day and your worst heartache moments, that if you can find an approachable group like an EBCI, that is the place to start. So I'm just going to say that is my summary of my lessons learned. And I'm going to go ahead and go off to the next slide, if you don't mind. Dellann already talked about this, and I completely think this is fantastic. Just if anybody is able to donate, $50 gets a patient one-on-one with personal patient caregiver time and engagement with the patient navigator and the clinical trial coordinator. This is just so valuable. And like Dellann said, it's free, but the free comes from people giving who understand how valuable this is. And then here's another way, in case you're thinking about it later, that you can support the work and mission of the End Brain Cancer Initiative. You can text EBCI to 44321. You can look at the website, which I've done many, many times. That's a fantastic website. And you can also scan the QR code right here and just give, and just know that people like me and my family and my mom and other people who know about this disease really, really thank you for your generosity and your understanding.
Thank you, Bryan. It's really hopeful for other people, caregivers, patients, healthcare providers, to listen to people's experiences, okay? So their healthcare experience. Thank you for sharing your story, Bryan.
Thank you for giving me the space. I'm looking forward to
Thank you.
doing it again.
But Bryan, I want to just say it's very, very important for other people to hear others' experiences and their own journeys, right? Through brain tumors, brain cancer, cancer journeys, really, because everyone learns from everyone else. And I think that we don't share stories maybe enough. We should be able to share more stories because we know their tools, their educational tools, because we all listen to other people's stories and we all listen from them and their storytelling and their adventure with this disease, with cancer. But we're talking about brain tumors and brain cancer today. The other thing that I want to be sure to stress to people, and particularly the caregivers that are here today, the End Brain Cancer Initiative never ever wants you to ever feel bad about something that you didn't know about, that you learn from others or you learn from us. Because as a caregiver, nobody, we don't know how to do this, right? Nobody teaches us how to be a caregiver. You kind of are thrown into it and you do the very, very best you can, and you learn along the way. And the other thing that's important as a caregiver is you are able to do the very, very best that you can do with the resources you have, the information you have, or the resources you're given, or the information that you're given. And so I know when I was a caregiver for my late husband, I learned a lot, but I still, of course, didn't know everything there was to know. I did reflect on some things later on, but then I learned not to beat myself up because I did the very, very best that I could based on the information and the resources that I had. And that's really all we can ask from anyone. So I just wanted to make sure we shared that with all of you. Thank you, Bryan. Anyone have any other questions for Bryan? I see something. Okay, someone says, How do you recommend managing urgency for starting treatment or tumor resection for full diagnosis with the importance of
Hmm.
getting second
And
opinions?
mm,
Okay. Super question. Does anyone want to address this before I do? Brian, do you have a take on that?
yes, if you don't mind,
No, go ahead.
the question is fantastic. I think this is exactly what happens. Our first doctor is telling you to do something now. And I've met very few doctors who recommend a second opinion when you're talking to them themselves. So the pressure is really on. Like, what do you do? Like, do you go get a second opinion, or do you look at or do you answer this doctor right now who's saying do this now? It's a tough one. My answer is 100% take the time to get a second opinion, because it is amazing how much information there is mixed out there among different doctors that you couldn't even imagine is out there. And sometimes in the pressure of that first diagnosis with the first doctor, they're trying to give you answers and they've forgotten to tell you something, or they don't specialize in something that you could use. So I think the second opinion is just paramount importance beyond an urgency to get treatment or tumor resection. That's my
Hey,
answer.
thank you, Brian. Tori, do you have your hand up?
I do. Yeah, I wanted to weigh in basically from also my personal experience where my tumor was to the point where it was actually life threatening. So we didn't have the luxury of getting a
Mm,
second opinion and had to just put our trust in the provider at the time because
mm,
I was they discovered the tumor on the 22nd of July in 2020, and I had it resected on the 24th, and I was inpatient for that time so that they could monitor and be able to get me in even sooner if need be, because it was causing, I didn't, it was called uncle herniation, and they said it was life threatening. So yeah, I did not have the opportunity. So I think that's one of the things. How serious is this tumor to get out right now versus do you have the luxury of waiting a few days to get a second opinion?
Thank you, Tori. I actually
mm,
will say that if we're just talking about GBM, there's 5% of all of the surgeries, the resection done to remove a tumor that ends up being a glioblastoma, glioma, are 5% of them are an emergency situation where that tumor does need to be resected. It does need
mm,
to get out of somebody's brain. The other 95%, because
mm,
I know I know most of you that are listening today will understand what I'm going to say. Most of you had something that happened to you or your loved one that brought you to your local ER. You went into the ER, they did some tests, they probably did a CT scan, they may have done an MRI. And then they probably said, it looks like there is a mass. We're going to admit you for 3 days and we're going to put you on steroids to bring down the swelling within your brain caused by that brain tumor. And then we're going to have surgery. We're going to remove that brain tumor. That is standard practice. It's not standard of care, but it is standard practice. And what most of you are going to understand is that when this kind of a situation happens, you're scared. You don't know what to do. They've just told you you have a mass and they're going to be operating on it. And it is very difficult to get a second opinion within 72 hours of being admitted into the hospital, particularly a second opinion from a specialist. So, my message to you, the question that came up was, how do you recommend managing urgency of stating treatment or tumor resection for full diagnosis? You tell your healthcare provider, whoever that is, when you're admitted into the hospital, that you want a second opinion. All right. And you want a second opinion prior to surgery. And then, of course, you're going to want at least a 1 second opinion, maybe more, after surgery and when you get your diagnosis back. So, just in a nutshell, because we could just simply do one webinar on this particular topic, and maybe we will in the future. But the End Brain Cancer Initiative can help you with that. We can execute second opinions for you. We can move your medical records for you into the hands of specialists. We can help you with those second opinions, even the urgency, even urgent second opinions. So just know that. There was another question that came in. So this happened to my husband. We did a nationwide clinical trial search. It says we did. I don't know who the we is. We ended up with the treatment that our original oncologist recommended, but I felt more confident in the decision having actually gotten 2 additional opinions. We did them virtually. We sent our medical records to expedite the process. It took about 1 week. Awesome. Wonderful. Yeah, it really is helpful that when you do get second opinions, the opinions are the same. And when they're not the same, it can be hard and it can be confusing, but it means you really need to look at everything, every opinion that came back. You just need to really look at that information, and just know the End Brain Cancer Initiative can help you with that too, because we have so much experience in this space. And then if you need another second opinion, feel free to get it, because sometimes that provides clarity. This has been a really great discussion, you guys. Thank you for participating. Our next speaker is Torey Gilbertson. And some of you know Torey. Some of you have actually heard Torey speak before with the End Brain Cancer Initiative. And he is a great speaker. He's experienced, by the way, and he will tell his story just in a little bit. His topic today is improving access to TTF field treatment and the caregiver patient community. Torey has his Bachelor's of Science in Health Science at the University of Wyoming. And in 2003, he received his Doctor of Physical Therapy degree from the Pacific University in Oregon. For the past 10 years, Torey has worked with children of all ages as a physical therapist in a clinic in Issaquah, Washington State, and 3 different school districts in the area. Thank you, Torey. He earned his PhD in rehabilitation science from the University of Washington in 2015. And that same year, he married the love of his life, and they bought a home in Snohomish County. Torey was diagnosed with glioblastoma, GBM, in July of 2020 after experiencing persistent yawning, increased daily headaches, nausea, and vomiting. His wife also noticed overall slowing in his cognitive abilities. For over 4 years, he has now been wearing the Optune Gio device. I know Torey recently celebrated 5 years of survivorship as well. So Torey, congratulations. He continues to work part-time as an assistant teaching professor at the University of Washington in the Department of Rehabilitation Medicine, Division of Physical Therapy, where he has worked for the last decade. Torey, thank you so much. You are on, my friend.
And thank you very much, Dellann. So my real goal today is to walk you through some of the fantastic resources that are out there, and both the understanding of tumor treating fields or TTF therapy and how to get it if you're interested in it. So going to the novocure.com website is a great place to start getting that information. And so you start with basically this slide. This is a screenshot of trying to get it so that you can see the novocure.com web address first. And then, but on that home slide, you see all these great links to figure out where to go. So the About Us is really about Dr. Voram Palti and how he discovered tumor treating fields therapy through his PhD work. And then it also talks about the different trials and when the approvals of the Optune device, the tumor treating field device, It's gone through and kind of the evolution of tumor treating fields. It's really an informative tab if you're interested in that. Then our therapy, there is a great place to go for just getting more information about tumor treating fields. There's little videos of how it works and more just information on how and why tumor treating fields is good, especially for treating glioblastoma. But it also talks about the other cancers now that they are using tumor treating fields for, including non-small cell lung cancer and mesothelioma, which is just fabulous that it's going beyond just glioblastoma. And now it's also being approved for brain metastases, so metastases to the brain as well. The Our Pipeline tab or box there link sends you to all the different trials that they've done over time and kind of where they're going with a lot of their research as well. And kind of where they're also planning on going, the other cancers that they're trying to work on right now. Our pipeline also has links to other clinical trials that may or may not even involve the Optune Gio device. So it's kind of a nice resource for cancer in general, and specifically brain cancer. The careers and investor relations tabs are pretty self-explanatory. If you're interested in working for NovoCure or investing in NovoCure, great places to get information. And then the news and media has some of the press releases, but that's also a tab where you can go to see some patient stories and get to know some patients a little bit better and hear some stories. It's really nice. But that's not really the point of my talk today, so I'm not going to go into that. We'll get into more of the important nuts and bolts of why I was asked to speak, and that's if you go to the top there and click on the Our Products, you can go to the either Optune Gio or Optune Lua. Optune Gio is for glioblastoma or other metastases to the brain. And so if you go and click that Optune Gio link, it takes you to the actual optunegio.com website. And you can see up at the top there are tabs for recently diagnosed with GBM, just starting Optune Gio, or currently using Optune Gio, and kind of figure out what you want from there or what's most appropriate. But a couple of the things that I wanted to highlight with that is if you're currently using the Optune Gio, you can go to this Optune Gio support, and then there's the reimbursement support tab that will take you to how you can get some of the reimbursement support, the number you can call to get that. I will say from my personal experience, NovoCure has been absolutely fabulous to work with getting either insurance approval for the tumor treating fields therapy. They have their own lawyer that fights those battles for you. So it's something that you can just take the burden off yourself and place onto them, and they pick it up and run with it from there, and maybe ask you for a little bit of input from time to time and sign a release form or whatever. But they do the fight for you, which is wonderful. And then also, if you need or are interested in reimbursement support, you can provide them with kind of your financial records. They can figure out about how much you can afford per month, and they have a lot of different donations and everything else. So they can figure out what is truly feasible for you so that you don't go into that major medical debt like Dellann was talking about at the beginning. And they'll really work with you to figure out how you can be provided this tumor treating field therapy without living in a cardboard box because of it. And so they've been really fabulous with that. It looks like you wanted to say something, Dellann.
Thanks, Torey. Sorry, I was waiting for the right minute to interrupt you. I apologize. I also thank you so much for covering this page on their website, because it's so helpful to everybody to use. They can help you with access to this treatment option. But what I wanted to say, definitely use their resources and their support services for that reimbursement support part you're talking about. But if if you are finding your needs are not being met with Novacure, you need to let us know, because we do have a person inside Novacure that we can directly work with on your behalf. So use what Torey is talking about first. Use Novacure's resources. And then if you find you need more support, contact the In-Brain Cancer Initiative.
Thank you, Dellann. Yeah. So I'll go through with a couple other things that are great to know about these different sites to also help you get more information or connected with other people in the GBM community as well. So if you go to the recently diagnosed with GBM tab, you can go down to this education and resources tab, and then see this join a webinar. That's some more information. And I'll also say that when you click on that link, you can get to finding potential open houses in your area where you can connect with other people that are wearing Optune Gio, who so have GBM and potentially their caregivers. There's obviously some FAQs, and then about My Novocure, which I'll get into in a little bit. But My Novocure is a little bit different than Novocure. My Novocure is the patient services arm of the Novocure company. And we'll talk more about all the great things that My Novocure does for you. Other things to point out, though, on this website are if you go on any of those tabs up top there, whether it's recently diagnosed, just starting, currently using, whatever, all of them have this hear from Optune Gio users, and then have this chat with a buddy option. And if you go to that, or just simply scroll down to the very bottom of the OptuneGio.com website, you can get to this as well. The chat with a buddy. You can be connected to either a patient ambassador who's been wearing Optune Gio or a caregiver ambassador. If you have questions from the caregiver perspective, you can talk to other caregivers of people with glioblastoma who are wearing Optune Gio. And so if you just go to that schedule a chat, you get to this little box where it asks for some information, your name, email address, phone number, and then your zip code, because that way they can put you with a buddy who's in your same time zone in general. And then you can go down, and here where we're going to zoom in, and that's where you can either show that you're a person living with glioblastoma or caring for somebody with glioblastoma. And that will be how they connect you with either a user wearer or a caregiver, or care partner, as they call them. And then it gives you the option of either a phone call or a video call. And then they will coordinate with you via that email address that you give, asking you for your times available. And then they contact a potential buddy, asking what their timeline is, and then it's all coordinated, and then they send you the link with the time and everything else, and works out pretty easily. So some other things to point out here is learning more about My Novocure. As I said, the patient arm, that is also down towards the bottom of that Optune Gio website. But My Novocure is able to help with so many great things. And here's another way to schedule that chat with the buddy program. This is again at the very bottom of the OptuneGio.com website, the webinar sign up, or some discussion guides to talk to your doctor and some questions to ask about how to get this tumor treating fields therapy and start with Optune Gio. You can download a brochure as well. But going back, as I said, I wanted to talk more about what My Novocure provides. Going to this recently diagnosed GBM tab at the top, education and resources, and about My Novocure. And it will show you all the things that My Novocure can do, but you can also contact them directly at this toll-free 855-281-9301 number, or emailing support@mynovocure.com. But here's some of the great things that they do. Again, helping you with insurance support, getting you to resources for your finances as well. If you need training or tips for integrating it into your daily life, resources for traveling, because it is interesting to travel with Optune Gio. Not difficult, but definitely different. Some treatment information, ordering supplies, all the different arrays that you wear, and other supplies that my NovoCure provides for you, such as batteries or this elastic netting. And then this tab, the troubleshooting any technical issues, is fabulous on the website as well for you as the caregiver or the patient wearing the Optune Gio. Is what does the alarm sound like? And you can play the alarms, you can hear, is that what it sounds like? And then you can go through this whole flow chart basically of what that alarm probably means and then how you can solve that issue as well. Really, really great resource for new users of the Optune Gio. It doesn't take long to start figuring out what those alarms are and diagnosing and troubleshooting them on your own. But at the very beginning, it can really help to figure that out. And I will also say that NovoCure has an app for both Android and the iPhone, and this same troubleshooting is available on that app. And if you're aware of Optune Gio, it also has some resources for reordering supplies and for looking at your usage as you upload your data to the web. So the app is really, really handy. Probably more so for the user, but as a caregiver, if you're the one who's helping order the supplies, it would really help you as well. So a couple other great resources that you can find as well. Going through down to the travel tab and a PDF of all kinds of different great resources to use for traveling, some tips for packing and traveling and everything else. And then can't forget going to that reimbursement support, as I showed you that link and tab earlier. Getting to there, they have experts that are there to talk to you essentially 24/7. And calling that number is fabulous, or sending an email, as I mentioned earlier. Another great resource specifically on that Optune Gio website is connecting with other Optune Gio users in the community. So joining an Optune Gio webinar is one way, but as I mentioned earlier, and I'll say it again, clicking on that join an Optune webinar is also a way to find a live in-person open house event potentially in your area. Or if you want to travel to one, finding out where and when they are. It's another great way to connect with other Optune Gio users. That is it. I am happy to answer any questions you may have at this point. Go back to that slide.
Torey, that was fantastic. I will tell you, I just learned a lot myself. Really wonderful. I think NovoCure has done a really great job on their website for resources to help patients and caregivers. But also, it's really important to know that there are live people behind, right? Those links or that phone call or that email that are employed by NovoCure. And they're actually employed by NovoCure to help you, the patient and the caregiver and family. And so, information and resources with all of us because they've really done an outstanding job, honestly.
Yeah, thank you.
So thank you.
And I know they are located, their office is
I
located
know
on the
that.
East Coast in New Hampshire. And I know I have called them at 2 or 3 o'clock in the morning, their time, and talked to a live human to troubleshoot an alarm that was new when I was first starting wearing the Optune Gio. And they were fabulous at walking me through everything and figuring out what needed to be done.
Yeah, I mean, we all know that there's important information online, But there's nothing like actually talking to somebody when you really, really, really need someone quickly and you need an answer really fast. So I appreciate that. So the website and the app are great improvements since I was an ambassador over 3 years ago. Thank you. I know who wrote that, and thank you. Yes, they've greatly improved their help and resources. I know that there is a couple open houses coming up. I don't have the details in front of me. Do any of you, Torey, do you have any of that information, or do any of my staff have that information? Because I'd really like to share it.
Hey, when I looked within the last week, I didn't see any open houses in this area. There's a couple that are happening in like on the East Coast and
That's
Midwest, but
okay.
nothing that's
We
that's
can talk
happening
about that.
in this
We can
the
talk about
Seattle
that.
area.
Yeah, but we can talk about that. This is a global event.
Yeah, and like say, it's only a flight away.
So, how about Tori? Can you research that for us and then report back to us about those open houses? So, they are open houses. And like Tori said, you can go and you can meet, patients who are using the Optune Gio device, the TTF fields technology. You can meet other caregivers, care partners, and then you can just go and learn and listen, and you can go and start community that way, right? I think they've been doing these open houses for a really long time. They're fantastic.
Yeah, and they
um,
typically have at least a patient, if not a patient and caregiver, that kind of tell their story as well
mhm.
on the main stage, and then have time for interaction beyond that
Yes,
as well.
yes, yeah, it's really, really great. So Tori, thank you so much for informing us today about some resources that are out there for patients and caregivers, but also financial resources too for this particular treatment option. So, really appreciate that. Our keynote speaker today is Aimee Hoch is going to be presenting today on a very important topic, navigating the costs of care and what financial toxicity is. We actually all might think we already know what financial toxicity is, but you know what? I don't think we do. I think there's way more to learn in this particular space. And so Aimee's going to teach us today. Aimee, so she's a licensed social worker, but she's way more than that. Aimee, her credentials include OSW-C. Tell us what that is.
Oh, that's a certified oncology social worker.
Thank you. Also, FACCC.
Okay, that's an organization, the Association of Cancer Care Centers. I'm a fellow for that part of that organization.
Fantastic. So she's a master's level in and licensed social work with over 30 years of experience in the healthcare and behavioral health area. Her practice is focused on oncology, specifically addressing financial toxicity. Aimee earned her master's in social work from Fordham University Lincoln Center campus and is a certified oncology social worker. I think it's actually really important we talk about a certified oncology social worker just for a minute, Aimee, because I know your patient population, right? And social workers are phenomenal and they all should be part of our team. But I do think it's important if we're talking about oncology, talking about cancer, that we're working with a social worker who is certified in oncology as a social worker. I do think the resources that they're aware of maybe are much more than we would get with a other social worker who's not certified in oncology. Aimee is an integral member of the oncology financial advocacy team at St. Luke's Grandview campus, formerly Grandview Health, where she created and launched the financial navigation program in 2018. Wow. Thank you for doing that. That's a great model for others to use. Thank you. Nationally, she served as a financial navigation specialist for the Cancer Support Community Helpline. And I think you're going to talk a little bit about that later. and frequently speaks on the topics of financial toxicity and financial navigation in cancer care. She is a fellow of the Association of Cancer Care Centers, ACCC, and serves on its Financial Advocacy Network Advisory Committee and is the incoming chair. Oh, congratulations for
Thank you.
2026 through 2027. Congratulations. Aimee also contributes to several other key organizations, including the Medical Advisory Board of Living Beyond Breast Cancer, the Pennsylvania Cancer Coalition Quality of Life and Survivorship Workshop, and she co-chairs the Pennsylvania Oncology Navigation Network, which is PONN. I'm just sort of thinking, wow, you're doing an awful lot. Amazing. Thank you so much for your commitment.
Oh, thank you. Thank you so much for having me. Hello, everyone. Like Dellann said, my name is Aimee Hoch, and St. Luke's is about 45 minutes north of Philadelphia. So I'm in Pennsylvania, and I'm honored to be a part of the Caregivers series at EBCI. I'm really glad you're here today. I know that for many people facing a cancer diagnosis, whether a patient or a caregiver, the emotional, and physical challenges are very overwhelming. So today we're going to talk about one part of that journey that often doesn't get discussed enough, the costs of care and what's called financial toxicity, and the financial strain or stress that can come along with a cancer diagnosis. I mean, cancer care has certainly come a long way. We have more treatment options and more hope than ever before. But along with that progress, the cost of treatment, care, and even everyday living expenses can become a burden. So, my goal today is to help you understand what financial toxicity is, why it happens, when it happens, and who you can reach out to for help. Then, our next presenter, Jennifer, will share information about insurance, assistance, and resources to help. So, let's start by talking about what financial toxicity really means and how it can show up during the cancer journey. When we talk about financial toxicity, we're really talking about the financial side effects of cancer treatment. This term was first coined in 2013 by Dr. Safar and his colleagues at Duke and describes, and this is his definition, the objective financial burden, the actual financial burden, and the subjective financial distress experienced by patients as a result of the cost of care. It's the stress, anxiety, and hardship that patients and families experience because of the cost of care, things like medical bills, travel expenses, lost work time, and insurance gaps. You might also hear it called financial hardship or financial distress. I often use the terms interchangeably. You'll hear that through my presentation, but they all describe the same experience. Many people find themselves having to make difficult decisions, like choosing between paying for medications or other essential needs. And that kind of financial distress can affect quality of life. We know that it affects treatment outcomes and overall well being. The good news is that by recognizing it, talking about it, bringing awareness to it, both on the provider side and making sure that everyone has access to a financial navigator at every single cancer center is part of my mission, but also for patients and caregivers, because it's hard to ask for help. So my hope is that by unfortunately sharing that it's common, it lets you know that you're not alone in this experience. So let's take a look at what's causing the financial toxicity that individuals and families experience. Financial toxicity is also framed about treatment cost, but we're going to talk about what's really impacting it. So the cost of cancer care is projected to reach $246 billion by 2030. New and expensive treatment combined with improved survival and longer treatment impacts spending. And individuals on oral therapy are particularly vulnerable to high out of pocket costs. And when you couple this with non medical costs, loss of income, or a fixed income, it becomes a huge financial burden. Now let's take a look at what's causing the financial toxicity that others experience. And it's often focused on treatment, and you heard that in the definition, but we know that it goes beyond that. So, beyond the cost of treatment, there are things such as the type of insurance and coverage you have that impacts the financial toxicity you experience, what your out of pocket costs are, if they're very high compared to someone who has more full coverage, the bills you receive. I often have people just so overwhelmed with the amount of bills that they receive that I say, bring them in. We're going to sort through them together. That can be so overwhelming and add to that distress. The prior authorization process can be extremely stressful, and going through the denials and going through that process. Having multiple appointments with different providers, your copays are adding up the more appointments you have. And then when you add in reduced work hours, loss of employment and income, that also further impacts it. We also need to consider, when I'm working with someone, I'm always considering their situation prior to treatment. So if they're already maybe coming to me and just diagnosed and are on a fixed income already, these now extra costs in their life are going to be a huge financial burden. There's increase in daily living costs. Your geographic location impacts the level of financial toxicity you experience, whether you're in an urban or rural area. There are travel costs, and there are absolutely costs for caregivers having to take time off of work, loss of income. So we know financial toxicity goes beyond treatment costs, but how many people experience it and how many are accessing the help that they need? This study was aimed at understanding the scope of those experiencing financial toxicity. And according to the findings, 74% of participants reported financial distress at a level of 5 or above on a scale from 1 to 10. That's a substantial majority. Other statistics reinforce the extent of the problem, showing that financial toxicity is not just common, but a problem experienced by many. And what's particularly concerning is that despite the high level of distress reported, only 40% of those affected actually access any form of financial support or assistance. This gap highlights a critical need for more awareness, resources, and accessible support systems to help individuals manage the financial burden. Let's take a look at what decisions individuals are often faced with in order to manage their cost.
Aimee,
Yes,
can we go back to the slide, please? Okay,
sure.
this particular slide that you're showing is really important. What is striking me and bothering me is, however, only 40% of patients, families, caregivers used resources such as financial counseling or financial assistance. Now, you probably have a pretty good idea why that is, right?
Sure. Yeah.
Are you going to be covering that, or do we want to talk about that just a little bit now?
I kind of wrap up with it, but I think it's important to talk about. So there are a couple of factors. So I have a few thoughts, Dellann, but chime in if you have a thought as well. So the one thing I know for sure is that not all cancer centers have a financial advocate or a financial navigator. Another thing you'll hear later in a story I share is that it's not a one-time thing. So it's not just about your first treatment, getting copay assistance for it, and then you're good. And I'll share that a little bit later. Also, there may be somebody there. Sometimes the department's called financial counseling at hospitals, but they generally are there to help people who are uninsured and help them apply for Medicaid, or they're helping to facilitate what's called financial assistance, or otherwise known as charity care applications. Not
Right.
this critical, proactive financial navigation from diagnosis through into survivorship. So part of my hope that you all take away, and I'll touch on too, I know for many reasons how hard it is to ask for help in this area. It's a very vulnerable situation when you're sitting there with your physician and you're worried about the cost. I've had through all my years of working with people, learning that they're worried about being offered a different type of treatment, not the standard of care that's cheaper. And just for many reasons, talking about finances, it's not something any of us are comfortable doing, especially we just were diagnosed and, sharing that with our doctor. So there's that too. And I think my hope and goal, main message for this, if you don't have somebody like me coming to you, please ask somebody on your team, because you'll see with my story I'm going to share how common and prevalent and like it's a long-term thing that we need to navigate. So Dellann, I'm not sure if I hit upon everything, but
You did, Aimee. And what I'm thinking of, and I know people don't know this, oftentimes people do not know about this. The fact is that the minute there is a diagnosis, and I'm just going to say any cancer diagnosis, any disease diagnosis, and honestly, I think one of your very first things you should do within the hospital is ask for the appointment to the social worker. The social
yeah,
worker is also known as, there's another term within hospitals, case manager sometimes.
yeah,
Sometimes I mean it. Ask for the appointment like immediately and then talk about whatever it is you want to talk about. But in this particular case, it's like I want to be connected to financial resources. I want
yeah,
to, if they have a financial navigator, I want to be connected immediately to that person. I think we don't know that these people exist within a lot of healthcare systems, right? And they are there to help, but patients, the general public doesn't even know that they're there to help.
yeah,
And I think if there's anything we can do, one of the things that we want this particular webinar and the videos, educational videos that will be made out of this webinar, is to that big takeaway is there's resources right there within the hospital. I would start with the social worker. That's where I would
yeah,
start, that you just don't know about, but you can have access to them. The other thing I would say is do not be afraid of potentially the stigma of the word financial navigator, right?
yeah,
People like you were saying, people don't want to talk about the finances. That people don't, blah, 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 blah. I don't want anyone to know my finances or the fact that I actually might need some help. I don't want to deal with that. I certainly don't want to share it with anybody. But a financial navigator is certainly there to help the patient and the caregiver and the family. And they really are part of your team. And I love someone wrote in, who has been in this space for a very long time. She wrote in, I have never even heard of a financial navigator before the recent ABTA conference, which was held in September, the patient conference. It's a newer term, right, Aimee?
yeah. I mean, I've been doing it for quite a while, and the term financial toxicity has been around for a bit, but in my work nationally, there are so many cancer centers and treatment centers that don't have a financial navigator yet. So it still is new. It's very much in its infancy. But I
Right.
like that you mentioned not to be afraid of the term. We're not a part of like billing or patient accounts. I'm not setting up payment plans for anyone. And I think you also made another good point, Dellann, that you might not know that there are resources available and you really haven't had to use your insurance to the extent that you're about to. So you couldn't know what you're facing. And meeting with someone like myself, but Dellann, you're right, going to the social work first is key because there's generally going to be a social worker in every cancer center. So if they do have a financial advocate, they can point you in that direction. But if not, they may be the person helping you with all of this. That's where I started before I developed our program. So, really important information.
Wonderful. Thank you, Aimee.
You're welcome. So we'll go to the next slide and talk about the sacrifices that this study found individuals were making. And this is a study from Dr. Chino and her colleague. She's now at MD Anderson, but she was at Memorial Sloan in New York. And these findings are striking. Nearly half of the patients, 49%, were willing to declare bankruptcy. Additionally, 65% reported being willing to make other financial sacrifices, such as borrowing money to cover the cost of care. And alarmingly, 38% were willing to sell their home to cope with these expenses. And you'll hear this in the one story that I share. It has happened. I've worked with people that have had to move. These numbers show how deeply financial toxicity can affect not just finances, but overall well-being and stability. So, patient sacrifices reveal the personal toll of financial toxicity, but these struggles extend across multiple areas of life. Let's look at a framework that can help us understand the full scope. Tucker Seeley helps us break down financial hardship into three interconnected domains: the material, psychosocial, and behavioral. Understanding these help us not just like know there's a financial impact, but how it truly affects individuals in other ways. So the material domain, that's these tangible out of pocket financial burden that someone faces. So the direct financial strain, the cost of care, copays, medication, loss of income. The psychosocial domain helps us understand the stress, anxiety, worry, social isolation related to financial hardship, and the impact overall on one's mental health and social well-being. And the behavioral domain really includes and help us understand those changes in health related behaviors that a person is faced with, and like trade-offs, delaying, like canceling appointments, delaying care, kind of skipping medications and stretching prescriptions over a longer period of time and able to reduce the financial burden. Now let's talk about financial hardship or toxicity and when it's experienced. So, like I mentioned, it's from diagnosis, and it's never too early to ask to meet with someone, a social worker, financial advocate, financial navigator at your treatment center. Because financial toxicity is not just about that one-time need when you first get started with treatment and somebody helps you with a foundation to pay for that cost. It's through treatment changes into survivorship and follow-up, and even into end-of-life care. So individuals can experience financial stress at multiple points along the cancer care journey. And it's a persistent challenge that can emerge at any point and many points. Recognize it across the continuum of care is key to providing care that truly supports individuals, not just clinically, but financially and emotionally as well. And for patients and caregivers, know that you're not alone. I share this so that know that you'll be partnering with the advocate long term and each step of the way. So understanding that financial toxicity in cancer care isn't just about the cost of treatment, it's about how unmet financial needs can affect the person's overall well-being. And one way to conceptualize this is through Maslow's hierarchy of needs, which helps us see how financial strain can impact everything from basic survival to self-actualization. So starting with the physiological or basic needs at the bottom of the hierarchy, where cancer care providers can consider these. It's different for an individual to access care that's being recommended if we're not meeting those basic physiological needs or going to that support group. So if somebody's struggling with food and housing, utilities, they're not going to be able to access care. So we need to look at the whole picture and the whole person. And if we think about the physiological needs, that's someone struggling for food, medications, paying for housing, their monthly bills. And then that safety level is actually where healthcare falls in. So if we're not helping with those physiological needs, access to the care can be difficult. And it also means like that security feeling of insurance coverage or job loss, anxiety around medical bills. And the love and belonging here is really about the strain on relationships due to financial stress and the esteem needs, feeling like a burden or loss of independence or self worth is important. So we really need to look at the whole picture. When a patient is facing financial toxicity, their unmet needs can ripple upward, affecting safety, relationships, mental health, and even the ability to pursue meaningful goals. So, keeping this framework in mind, next I'd like to share a story with you with the emphasis on how all copays and all costs count. This is someone I worked with. We'll call him Steve, 55 years old. And at the time of his brain cancer diagnosis, he was employed with employer based coverage. I helped him apply for short term disability through work, eventually SSDI. He had a loss of coverage. We then assessed him for Medicaid. He was awarded his SSDI, and then we helped navigate him to a marketplace plan. So all of the interventions that I provided are in green, and in black are kind of the needs that Steve had. So this is going to illustrate how it's really a whole picture and not just a one-time intervention. So for his infusion treatment, we used copay assistance, and then when he had full coverage with Medicaid, it covered it in full. But like I mentioned, all costs and copays count. You don't just have your treatment costs, there are office visit copays, scans, physical therapy. I'm leaving out many other services, but other services and providers. And what we did is we applied for hospital financial assistance for those. I
Amy has a
also can,
question.
sure.
Amy, sorry to interrupt you.
No, it's okay.
I'm assuming SSDI is Social Security Disability.
Yes, sorry.
Okay,
Yes.
thank
Yeah.
you. And then Steve, you helped Steve apply for short-term disability, STD, through work.
Yes.
Can I ask, in Steve's case and your experience, once you helped Steve apply for short-term disability through his work, how long did it take for his short-term disability benefits to kick in?
All I can say, all policies are different based on what your employer offers and what you've opted into. Like
Yeah.
I have two options. Some of them have longer waiting periods than others. So if you pay a little bit more each month in your benefits for a short-term disability policy that is only a 2 week waiting period compared to, say, a month waiting period. So it's hard to say exactly, Dellann, but they all vary. But there generally is a waiting period before the
Mhm.
income starts.
Yes, absolutely. And then, and eventually Social Security disability. And it's the same. That takes a while to kick in. There's a waiting period for that as
Yes.
well. And it's also, as you stated, every policy is definitely different as far as what the percentage is related to Social Security disability, correct? Do you know?
The policy for short-term disability.
I'm now on short. So, oh, yeah, yeah. Sorry. Yes.
That's
Yes.
okay.
Yes.
Social Security disability. So Social Security disability is based on work credits, ability to work or not, medical information. But when you mentioned a policy for short term disability, they're all different and
They
they're through
are.
your employer or some states have offer short term disability, like California is one, New Jersey is one. So it's going to vary with short
Mhm.
term disability.
Thank you. Now, in
Yeah.
Steve's case, related to his infusion treatment, you were able to help him locate copay assistance, correct?
Yes.
Okay. Are you at all able to talk about that copay assistant, what that looked like for him?
So just in general with copay assistance, and I know Jennifer's going to touch on it too. It can be either a copay card through a manufacturer if you have commercial insurance, or sometimes we look at foundations, generally for those who have Medicare, some commercial private plans. So that umbrella of copay assistance includes both copay cards and foundations.
Thank you. That's very helpful. Thank you.
Sure. Yeah. And then hospital financial assistance, that's through the hospital. I mentioned it earlier. Like there's generally financial counseling at each hospital. They will help you with that application. And that's for all those other copays, for all those other services. And I've had people forgo some of those because they didn't know hospital financial assistance was there. For instance, physical therapy is often a co-insurance. So it's not just a copay, it's a larger out of pocket cost with some plans. And so, such a vital, important service in your overall wellness and well being that many of my patients were foregoing that. Also, palliative care. So, once I found out about that, we put things in place to make sure they knew that this help was available. And then there's other costs, and that's how myself and the social worker work so closely together for non treatment related costs, such as grant programs for transportation, housing, household bills, food insecurity. And I know you'll hear a little bit about some resources about them later. I do want to mention there's sometimes outside testing company bills, like for biomarker or molecular testing companies. And I like to mention that sometimes you get a pretty large bill for those, even though you have insurance coverage. But just know that they have internal financial assistance programs built in. And then I wanted to mention the other, cost that counts is caregivers' time away from work. And I helped his wife navigate FMLA. And this was ongoing, and I needed to monitor the changes at all times.
So the FMLA, it's Family Medical
I'm
Leave, what? Family
Act. I am
Act.
so sorry. I keep talking in abbreviations. It's the Family Medical Leave Act. Yes.
Thank
You
you.
would talk to your HR department about that.
Thank you. And what is that?
So it's a law, it's a federal program. It generally gives you 12 weeks of time off that can be taken consecutively or intermittently. It kind of is a protection for your position, and employers that have 50 or more employees, or kind of federal state institutions like schools or the people that work at your county, they have to offer it. So it's really a placeholder for your position. It is not income. So people generally alongside of that will use their PTO or vacation time or their short-term disability. And so they go side by side. But that's what the Family Medical Leave Act is.
Thank you.
Sure. So I also wanted to mention non-treatment related needs, and many cancer centers are really needing to assess for these now. We built a whole food insecurity program at our cancer center. We have a screening tool for all these. Our inpatient side also does as well. So we need to recognize that these are also a financial burden and address these as well. And generally, like I mentioned, I partner with the social worker who helps with these. We kind of partner together there. So, and I mentioned all of that in Steve's story too. I'm just going to take you on a little journey, and this really illustrates that addressing financial toxicity is long term, that my role and your experience may be similar. So in 2019, I met with this individual. This is someone I worked with, and She was just diagnosed. And that's when I started the cost of care conversation to start building that trust and let her know that I'm here to help support her. At that time, she had commercial coverage through work. And you'll see how I help navigate her through many different income, treatment, and insurance changes along the way. So she had chemotherapy and copay assistance at the time, and she was working. And then in 2020, she had a loss of employment and insurance. And with a fund for premium assistance, because she had met her out of pocket already for the year, we were able to help her afford Cobra and have that full coverage for the remainder of the year and continue treatment. We knew that wouldn't be sustainable into 2021. So we looked at a marketplace plan, and it wasn't sustainable because of the premium each month was a burden for her. So we looked at a marketplace plan with a lower premium. She had a change in treatment, and we were able to use a manufacturer copay assistance card to help her meet her out of pocket in her first treatment of that January, which gave her full coverage for the whole year. She could access her care without any interruptions. I helped her apply for Social Security Disability, which is SSDI, and she continued to access her treatment. So in 2022, I recognized based on her household income that she was going to be eligible for Medicaid. So she moved off the marketplace plan and onto Medicaid with full coverage again for another year in 2022, continuing her new treatment. And then in 2023, because she had been on Social Security disability for 2 years, she became eligible for Medicare. And this often is a financial burden, becoming eligible for Medicare, because you're paying a lot each month for coverage. So she enrolled in A, B, a supplement, and a Part D, and with premium assistance was able to afford the cost of her premiums and continue full coverage again. And I just want to say that through that, there's always different life events. This is a person that lost her home that she built with her husband and raised her family. A lot of changing roles. She also became a caregiver herself for her husband. He ended up with a different health need. So it's really also helping navigate through those transitions as well.
Aimee,
Yes.
the person you're talking about that you helped in 2023, I believe I understood this correctly, with full coverage with premium assistance. So it's full coverage. Was that for the Medicare, A, B, and D supplements?
Yes, and actually, this is the same person across
Yeah.
a timeline. But
Okay.
when she was eligible for Medicare, she had original Medicare A and B she enrolled in, and she paid for a supplemental plan, which can be high, or what's known as a Medigap plan, and then also had to purchase a standalone Part D plan. So because all those premiums become a financial burden, I was able to go to an outside foundation that offered premium assistance and help her apply for that. And that helped her for another year pay for her premiums.
Thank
They
you.
depend on if they're open at the time. It just happened to be open, the fund that, and I helped her apply for that.
That's fantastic because I'm going to be honest, she likely would have no idea about how to navigate this, even if she felt good enough about doing it, feels it physically and mentally, she probably wouldn't know how to navigate and definitely go to the foundation you're speaking of for
Right.
the premium assistance coverage. So thank you.
Yes. It's very complex.
Uh,
Enrolling in Medicare is overwhelming. Yeah.
yes, it is. And if you
So
can't
we'll
pay, yeah, and if you can't pay for those premiums,
right.
you know so I bring this up only because I want those listening to understand that within your hospital setting, even though there sometimes are not financial navigators, there are social workers who can help also and connect you, I think, Aimee, right, with financial navigators or the financial department.
So they generally at hospitals, the financial department help with like Medicaid and charity care applications. But I could say, and at the end, I'll share, if where you can find help if you don't have a financial navigator. But specifically to Medicare, a really good thing to know is that every county in this whole country, you can go on ship.org. They have a directory of to the county office on aging. It's called something different in every state and every county, but basically every county office on aging department has what's called ship counselors, and they are unbiased Medicare counselors. They are volunteered, which makes them unbiased. They are not getting a commission on plans. They are very highly trained. So if you go to ship.org, you can put in where you live and it will route you to the right ship counselor and county. Yeah, state health insurance program, I believe it stands for.
Thank you.
You're welcome. Okay, so of course, I just want to reiterate and we'll wrap up at the end. Please ask your social worker or anyone on your team, your nurse navigator, if you could speak to a financial navigator or financial advocate at the time of diagnosis. It's never too early to ask. You'll start to build that relationship with that person, and then they're there to help you navigate through all those changes. Ask to speak to a social worker. They may be the person handling this at the cancer center, but if there are both of us, they're going to help with all of those non-treatment related needs. I just wanted to point out some resources. The End Brain Cancer Initiative, like Dellann said, there's insurance navigation there. The American Brain Tumor Association, they have a care line. Cancer support community, you could call in and be connected to financial navigation through their helpline. OncoLink. So the rest are kind of websites that are extremely helpful with webinars, videos, tools, things you can print out that are really helpful with navigating all of this. OncoLink, Triage Cancer, and Cancer and Careers. And I'll end there and just say thank you so much for having me today. Yep, there are
Thank
my
you.
references.
Thank you, Aimee. Hey, I do have a question for you, Aimee. Thank you very much.
Sure.
The helpline that you that you respond to, you are on the other end. Cancer, what is the organization again?
Support community, cancer
Yeah.
support community.
Yes. Can you talk about that a little more?
Sure. I don't answer the line. There are navigators and social workers who are there. I believe it's 8 to 5. It's a national organization, cancer support community with local offices. You may be familiar with Cancer Support Community and Gilda's Club, but their national helpline, you can call in for support, any needs. And then if there is a financial need or insurance need, they will make the referral to one of us.
That is amazing. I wish I had known about that resource, right? A
Yeah.
long time ago, or even today, to be honest.
Yeah.
There's so much that's hard to understand.
Yeah, and I will say that if you have a financial advocate or navigator in your cancer program, they're really the ideal person because they know your treatment team, right? They know your treatment, your doctors, the area, but if you don't, that is an incredible resource. Like we mentioned, many treatment centers don't have that role yet. So,
Mhm,
yeah,
mhm.
just
I
wanted to
wanna
mention that.
Yeah. Thank you for creating the financial navigation program that you created,
Oh,
and
thanks.
thank you for talking to us. Thank you for doing that. You've really started something that's so necessary, and really appreciate it. I do think about patients and their families, and I know that the burden, financial toxicity, financial burden gets in the way of treatment. And I also know that when we think about disease and we think about cancer, we know that stress is just a big bad factor for that particular disease. And so
Yes.
we have to figure out a way to create less stress on these patients and these caregivers and their families caused by financial toxicity. So thank you for doing your part.
You're welcome. And just a correction, it's shiphelp.org, and I put it in the chat for you.
Thank you so much. Yay.
Thank you for having me.
Before you go, if anyone else has any questions, please put it in the chat if you would, so that we can grab Aimee before she signs off, if she's signing off. Just because this is such an opportunity. I hope it's okay, Aimee, also, the helpline that you were talking about. I mean, anybody can call it, right?
Yes, anyone can call it. Yep. Caregivers, um, patients, anyone can call it. And they offer a lot of different services.
I wanted to make sure everyone saw your email address. I also wanted to make sure everyone had the phone number for the Cancer Support Community Helpline, which is 888-793-9355. And that is open to everyone. Thank you, Aimee, so much for sharing that resource as well. Okay, as we wrap up Aimee's presentation and our questions, and really, I mean, thank you so much, Aimee. I feel like there's so much we just talked about that could be its entire segment for a disease
Yes.
education video, to be honest. So thank you so much for highlighting several things that were helpful and for us to learn from. Thank you. We're going to move on today and hear from Jennifer Natola. And Jennifer is going to talk to us about essentially Insurance 101 and resources for out-of-pocket expenses. And so we are thrilled to have Jennifer joining us today. Let me tell you a little bit about her. She's a seasoned and strategic leader in revenue cycle operations with nearly 2 decades of experience in healthcare finance across the life sciences sector. Her career has been defined by a hands-on, people-first approach, building and guiding high-performing teams that not only optimize revenue, but also operate with purpose and empathy. Empathy. We need that. Thank you. Her passion for oncology reimbursement runs deep. She is committed to ensuring that every action taken, whether by herself or her team, contributes to the best possible experience for patients and their caregivers. Jennifer has always taught her teams to view each claim as a patient, not just a transaction. This mindset drives her work and reinforces the human impact behind every decision. With a deep understanding of payer dynamics and insurance navigation, she helps organizations overcome reimbursement challenges and accelerates resolution paths. She looks forward to bringing her expertise to the End Brain Cancer Initiative, offering support, guidance, and practical solutions to patients and caregivers facing insurance denials, ensuring they receive the care and attention they so deserve. Welcome, Jennifer.
Thank you. I'm so excited to be here.
We're excited to have you.
Great. So I'll just start with Aimee did a fabulous job covering really how to ask for help. I will talk a little bit about some resources, but Aimee did an amazing job, and I don't want to take away from anything that she shared because it was so good. So I think we can just go ahead and get right into it then. So, one of the things to think about when you're thinking about out of pocket expenses, I don't think a lot of people get an opportunity to be taught about what their insurance actually is. We don't always fully understand what's health insurance, what's life insurance, what's home, car, boat. Like, we just don't understand the details around insurance. So, it's important to try to understand your policy. And I know that that might seem overwhelming, but you can always ask for help. And that is something that I will be here to help and support with the End Brain Cancer Initiative. But if you have questions, you can talk to your employer if you're getting insurance through them, if you're going through an insurance broker, and most importantly, call your insurance and ask them to explain your coverage to you. Use them to help you have a better understanding as well. That is what they're there for. And the most important thing is, just because you have insurance, it does not mean that everything is covered. You pay for your insurance, but you're paying a portion, and then you're signing up essentially into this contract that you will pay X, Y, and Z on top of your premium for this coverage. So it's really important to understand where and how you might have limitations within your insurance. And one of those can be that sometimes certain prescriptions, procedures, or different types of treatments require a prior authorization. And what that is your insurance company ultimately stating that they believe this treatment is medically necessary, but that is not a guarantee of payment either. So understanding that you might have to secure a prior authorization, but it should never be you securing it. It should be the healthcare provider who wants to provide you that treatment. So again, talk to the doctor, talk to the facility, whoever it is, and maybe they might need you to fill out a form or something, but you should not have to secure the prior authorization. And then just really the most important thing, if I could stress anything, is making sure that you understand what providers and facilities are within your network and your insurance, and you do not see out-of-network providers. That is one of the biggest, I think, scary challenges that could come up is your out-of-network benefits are more expensive than your in-network. So again, you are paying for X amount of coverage. And if you see in-network providers, you will pay less. If you see out-of-network providers, that is how they get you. And you will have to pay more. There are certain ways to navigate around some of that, depending on your plan or what you might be asking for. Sometimes you can get in-network exceptions, but really trying to make sure that you are seeing in-network providers and going to in-network facilities will make the difference in the long run. And then thinking about your managing your strategic costs, kind of just covered that, making sure you use the network providers. But you can always also ask, is there a generic medication? When you get your bills from all of the different places, ask them for itemized. Sometimes their statements aren't clear and they aren't itemized, and that is okay to ask for what you need. There's no better advocate than yourself in most of these situations. And then payment plans are so critical. Do not be afraid to ask for one. And they might push you into something. We need you to pay $250 a month. Pay what you can pay. As long as you're making payments, you're going to keep your account in good standing. But people don't want to tell you that. So, like, you just have to remember that paying something is better than paying nothing. And that's what keeps your account in a good standing. And talk to them about it. They want to get that bill paid too. They're going to work with you. So don't be afraid to ask for that help. And then financial assistance resources. So Aimee is a financial assistance resource through and through. And what she does at a hospital is exactly what I would advise. Like, seek out a hospital financial counselor. Again, ask for that help. I know it's really challenging, and Aimee touched on this, to ask for help first and foremost, but that is okay. You need to do that. You cannot do this alone. So asking for the support that you need is really going to be critical. And navigating, how do you do this? What are the nonprofits that you might be able to ask for help for? What are the copay assistance programs and the government programs? Yeah, it's overwhelming and confusing. And I don't even know how to navigate them all successfully. So the more people that you can ask for help, the better you will be. But there are people that are the subject matter experts in these arenas, and they will help you and they will do it compassionately, which is also really important. And then, really, when I think about like tips for caregivers, keep all of your records. I know for me, for example, I'll get this thick envelope. I have United Healthcare for my insurance, and inside's like 25 pages, and it says on it, this is not a bill. That is correct. That is your explanation of benefits. This is your insurance company telling you how your benefits have been applied. Save that. And then as you get your invoices from doctors or facilities or anything else, look at it and compare. Are they billing me the same way my insurance company said my benefits were applied? And that is like your first like check and balance if you think about it. And then if something does not seem right, and even though, let's say it's a hospital that's sending you a bill, you can call your insurance and say, I received this bill. Can you help me understand? And then in some cases, your insurance company might even call on your behalf to the hospital to say, you're incorrectly balance billing my patient or whatever the situation might be. So don't be afraid to start with your insurance company. They know your benefits best. Yeah.
Jennifer, can you explain bounce billing?
Sure. When your insurance company processes a claim, they use certain codes, and those codes will dictate if there's a patient balance or not. And there's a lot of like the No Surprise Billing Act and different things out there where facilities aren't actually able to bill you for that balance. And in some cases, that could inadvertently slip through the system. There could be a problem on their end with their system. There could have been an oversight by a person who's keying it. So that's why it's important to ask on that because again, that explanation of benefits you get from your insurance has shown you what you should be paid for. And if you're getting something different, then you were incorrectly billed. So making sure that you are just aware of those two matching up.
Thank you.
Yep. And then again, stressing a lot of what Aimee said as well. Like there are support groups out there that can help you navigate this and sometimes maybe even be able to do this on your behalf. And then really, it comes down to at the end being able to ask for help and being able to seek out those resources so you're not alone as you go through this process. So, one of the resources that I have stumbled across that I thought would be valuable to talk about here is the Mission for Maureen. And why I really like this is because this is $1,500 that can be used for anything. So, it does not have to just be your medical bills, it could be your rent, your mortgage, utilities, car payments, anything like that. And when you fill out this application, you'd actually send them a copy of your bill. So, you could send them your car payment. And if you're approved, they're going to pay it directly for you, which then alleviates that burden as well, because you could have the best intention of, I need this financial assistance, and then you get it. And then all of a sudden another bill came up. And it's like, which one's the most important? But if you know that you're earmarking something, you could then even call your car company, your loan company for your car and say, hey, I'm working on getting this paid. Could you allow me some time, whatever that conversation looks like. Again, it's the same thing. Don't be afraid to talk about this and ask for the help that you need. So I think that this is something that's important to think about is, and Aimee covered this, life continues on. Our bills do not go away. So how do we figure out getting the support that we need? And that's by researching some of these, and ultimately you would know best based off the requirements when you start to look at these applications. Of course, there's always going to be a financial aspect to it, so depending on your income or things like that, that will heavily factor into it. And then you can see in this one I called out, the completed application form, a pathology report, a photo of yourself, and 3 copies of your bills that you need help with. And then there's always a processing time. And I will tell you, from what I've learned, December seems to be a difficult month, I think, for people with applications. It's the holidays, it's the end of the year. Do they have the funds? So December seems to be a little bit challenging, but I think no matter what, you apply anyways. And think about it as like, okay, I'm going to block 4 hours on a Saturday and I'm going to apply to these 4 grants that I might be able to get assistance with. And most of them will need a lot of the same information. So, you could get approved for all 4, you could get approved for one, but it doesn't hurt to try. Musella Foundation is another great one. So this is up to 5,000 in financial assistance per applicant. And this is used though solely for the cost of your drugs for your treatment. So there are some requirements in regards to what are you being treated for? What type of drug are you being prescribed? Again, the same, you have to think about your income requirements. And of course, there's no repayment. I did not specifically see anyone say a repayment is required, but they called this out so intensely on their page. I wanted to make sure that I put this here as well. But they have other resources as well. Again, like the online support groups, chat rooms, newsletters. This is where you can connect with somebody else going through the exact same thing that you're going through, and you can, make connections that could be really impactful for you. All right, there is a lot on this slide, so I wanted to squeeze this all in, but this is all of the additional resources as well that I have come across. And National Brain Tumor Society is fabulous. If you have not checked out their page, I encourage you to do so. Both the National Brain Tumor Society and American Brain Tumor Association have lists of programs that you can really look into. So I focused on American Brain Tumor Association, and I've captured a couple of them, but you can see that they have, again, even programs around like the travel and the lodging, which can be really important. We don't all live within a 30-minute drive to the facility we want to be treated at. We want to see the best doctors. That could be a 2.5 hour drive, and you might need to spend the night somewhere. So why not ask for assistance with that? And I can even tell you that I live on the East Coast, and when I take my mom to Dana-Farber, you get your parking reimbursed, you can get discounts at hotels. You just got to talk to your facility as well, and you're able to get additional help that you might not have even known was available. So I did call out a few of them, which is Help Hope Live, Kim's Hope for glioblastoma, the Pan Foundation glioblastoma fund, and then the Darren Dalton Foundation. So these were four that definitely stood out when looking at this. Their phone numbers are provided, and I do believe that everyone will have access to this resource, so you will be able to go ahead and pick up a phone if you want. I know sometimes searching online can feel overwhelming as well, and you just want to talk to someone and not have to figure it out yourself. So I wanted to make sure to provide the phone numbers for everyone too.
Thank you.
This is Insurance 101. So, just to give a little insight here. So, I know that we've talked a lot about premiums, but I just want to make sure that everyone understands that insurance is not free, and we do have to pay for it. And the thing about it is, this is what keeps your health insurance active. So, if you work for an employer, this is the amount that's taken out of your paycheck every week, biweekly, monthly, however it is that you are paid. And so the best way to describe it is you are paying into this, whether you go to the doctor or not. This is guaranteed. This keeps your coverage active. So when you do need it, it's there and ready for you. And then next would be deductible. So thinking about your premium, all right, that's set in stone. I know I'm paying this. When you choose your benefits, so again, when you're looking at, what is it that I want to pay? What can I afford to pay? The deductible is the amount of money that you're going to have to really pay out of pocket before your health insurance really starts to cover care for you. And the number one thing to think of with that is the lower your deductible, the higher your premium in most cases. And the lower your premium, the higher, it goes vice versa. So thinking about if you have a deductible that's $1,000 and it's January and your plan just started over, and you haven't contributed to that deductible at all, you're probably going to receive a bill for that full $1,000. And I know that I've had plans in my life where my deductible was $3,000. And so it's really making sure that, do you have the ability to cover that? And how might you cover that if you have your deductible? So really starting to think about that when you're choosing your plans. And sometimes, again, if you're going through your employer, you have FSAs or HSAs or something like that that you could contribute funds to. But this is where, if you don't have that, thinking about where do you get some of these supplemental insurances, a secondary insurance, or how do you apply for copay assistance or financial aid through your facility. The next one is copay. And so copay, I think most people are probably familiar with. That's when you go to your doctor, you go to registration, you're checking in. They typically ask to see your driver's license. They ask to see a copy of your card. And then they say, your copay is $30. How would you like to pay for that today? And that is a standard requirement for most physician office visits, except for preventative care. So like your annual physical or something like that might not have that copay. And your copays will be different on your plan for specialists. So remember that as well when you start to see physical therapists or different types of specialties, that a copay can increase. It's not always the same. And your copay, a lot, you're probably familiar as well around your prescription cost. So when you go to your pharmacy, but the different tiers of medicines in your policy, you'll see one set copay could be 10, one's 20, one's 30. And based off of the type of medicine that you're getting, the different copays would be applied. And then coinsurance. I think coinsurance is the sneaky one that I don't think people always get, because you have a deductible, you have to meet that, you have a copay, everyone's familiar with paying that. But then coinsurance is the bill that you get in the mail later. And it always surprises me. And I know that it can surprise other people. So essentially, this is a percentage that is going to be your responsibility until you've met your deductible, until you've met your out of pocket. So a lot of plans have a 20% coinsurance. Some could have a 30% coinsurance. I don't see too different. A 10% coinsurance is beautiful. But when you think about that, again, I have a little example in here. So you get a medical bill for $1,000, you owe $200, your insurance paid $800 because your deductible has been met. So that is your 20%. So you might have gone to the doctor's office, paid your $30 copay, and then you're getting this $200 bill and you're like, but I paid $30 when I was there. Why am I getting this? It's because you have a coinsurance part of your policy and you ultimately have an out of pocket that needs to be satisfied. So if we want to jump to the next slide, we can talk about out of pockets. This is the thing, though, that I do enjoy, because I know that I've had years where I've met my out of pocket maximums and then everything's covered. And that is like, you have a golden ticket to healthcare for the rest of the year. So sometimes that can be really nice, but you have then had to pay a lot up front to meet that. So it's a double-edged sword. So think about this, where your out of pocket maximum is typically large. 5,000, 6,000, that is going to include your deductible. So if your out of pocket max is 6,000 and your deductible is 3,000, and then that means you have to pay an additional 3,000 between copays and coinsurance. And once this is met, you will not receive another bill. You will not pay for a prescription. You will not have to pay a copay when you go into the office. You will, however, still have to pay your premium, because remember, that is your guaranteed must pay to keep your insurance active. But you're out of pocket when you're looking at your insurance benefits. If you can find a low out of pocket maximum, that is always going to be the better plan, because that will ultimately mean that is how much I'm going to pay out of my pocket. And the most important thing that I can stress on this is you will have an out of pocket for in network and an out of pocket for out of network. So you have to be mindful of that. Again, when you're thinking about who am I seeing, you want to see an in network doctor. The reason why is your insurance company has essentially created a contract with a group of physicians, a group of hospitals, and they have guaranteed that they will pay them a better rate because of this contract, this agreement that's with them. And therefore, they know they're going to get more business because people in the area that have this insurance are going to go to this hospital. And when you start to be serviced at an out of network, you will be charged more. And sometimes what can be really super sneaky is your lab work. This is one of the things I think that surprises the most people is you go to an in-network provider, and when you're at that in-network provider, they then take your lab work and send it off somewhere else or tell you to go somewhere else. And that place might not be part of your network. And so just making sure to do that due diligence as well. And I think that's the most important piece is if they're telling you to go somewhere or they send your stuff, ask those questions. Yes.
Aimee, so what if you do ask those questions, such as, where is my blood work going? And it turns out it is out of network. What do you do then?
So it can be tricky. So if they've already sent it, I think the challenge is then finding out from them, okay, so based off of my coverage, they won't pay for this because it's out of network and maybe there's no payment at all. And then it could be a conversation with that lab directly. I didn't know that my blood work was being sent to you. If I had known, I wouldn't have agreed to this. I think the other thing is just making sure that you have that conversation. And a lot of labs are in hospitals now. And so sometimes, like, you could go to the off-site labs like a Quest or some other places. There can be certain call-outs in policies that don't allow those types of labs to be used. So again, it's reading your benefits up front and definitely knowing that. I would encourage everyone at the beginning of every new policy year to make sure that you are aware. But if not, upon a diagnosis, I know that can be overwhelming, but that's where you can reach out and ask for help. And, it's something that even I would offer to help you with is, looking at your policy information with you just to make sure you have everything clear and understood. And they typically send you packets of information or you can get them online and you can dig into the details that way.
Jen will probably cover it at towards the end, but she is available to help people understand their insurance policy and including all of the things she's talking about
Yeah.
and strategy too, right? And
Yes.
so she's available now through the End Brain Cancer Initiative. And thank you so much. I know
Yeah.
you're going to be helping a lot of people.
I look forward to it. And then we covered this essentially already, but an explanation of benefits and EOB, again, that will be what you get in the mail. It will say this is not a bill. It'll have your insurance company logo on it. I cannot stress enough to save that. And additionally, save all of your bills.
Hmm.
I'm not a tax expert. I'll never pretend to be, but that might be something at the end of the year you might want to talk with an accountant on. Like, do you itemize like all of your medical bills from the year? There are definitely things that could benefit you from that as well. So making sure that I would grab a file folder, even an accordion folder, something like that, and just start saving everything. I know nobody likes to get stuff in the mail anymore, but I never, when it comes to health related stuff, will never sign up for electronic statements because of that reason alone. I want to get paper copies. I want to be able to review my stuff. If it comes in an email, then I have to print it. It's a hassle on my end. Let them print it. It does not cost them anything. And that way you can get it in the mail and you can save it for your records. It's much easier than you having to do it yourself through your email.
Thank you.
You're welcome. So that is it on my end. I don't know if there's any questions from anyone. If not,
Okay, let's see. I'm looking, I don't see it yet. So, anyone who has questions, please either unmute yourself and ask the question or throw your question, type it in the chat. Elise, can you go back to Jen's title page, which is her contact page, and just have it up while we talk just for a little bit so people know how to get a hold of her? It's Jennifer at endbraincancer.org.
Mhm.
That would be awesome. So that would be really, really great. I am I'm kind of laughing a little bit, Jen, because I'm like, oh, sorry. I hate insurance policies.
I know.
Okay. Okay, they're cringeworthy. I'm just going to be honest. That's my take on them. And I will be honest, I'm not sure I've ever read my entire insurance policy ever.
Yeah.
I wish they would write them differently, one, so they're just super layman terms,
Yeah.
man, and cut out all the stuff. But I'm sure there's legal reasons why they write them the way that they write them. I thought it was really great. You were talking about, of course, in pocket.
hmm
So something happens. I'm at my healthcare provider. They say, okay, I want to send you for a special, like you were talking about, either a special test or I want to send you to a specialist.
hmm
So it is the responsibility of the patient or their caregiver, family member, whatever, to ensure that whoever you're being sent to, whatever person, company, healthcare provider, lab, is in your
So
policies network, correct?
it does depend. So an example would be is if you're being sent to another facility for, let's say, an MRI. Typically, those might require a prior authorization, and so there's going to be someone at the facility that would verify your benefits, and they would help with that piece. But it also depends on your plan as well. And I did not get into HMOs, PPOs, EPOs, anything like that. But if you have a PPO, you can choose who you go to without a referral. And therefore, that's where it can become a little dangerous because you could do some research online, find someone, say you really want to see them, but without checking that they're in your network, that's where you could have a problem. If you have an HMO plan, you are going to be more restricted because they won't let you just go ahead and reach out to someone without that referral from the doctor who's sending you there, which means more likely than not, you will end up with an in-network facility or provider. So that's the other piece of your plans that you kind of got to understand is what type of plan do you have, because some have stricter rules on how you go about seeking coverage and have made it so you won't get blindsided, and others give you more ownership, which can be really nice. But then it is up to you to make sure that you're doing that due diligence. Yeah.
What does PPO stand for?
Oh, man. Of course, you're going to ask me that. Hold on. So it's like I know what all of this stuff means on the back of my head, but I don't always know.
I forget
Preferred,
too.
yeah, preferred provider organization.
Thank you.
Thank you.
And then the HMO, hospital, is it managed?
I believe it is. I'm just double checking. It is health maintenance organization, is what it is.
Okay.
Yep.
Thank you.
Yep.
Thank you. Okay. So I guess I'm not seeing any questions, which means you
I
didn't.
have a question, Jen, for you.
Sure.
What's the difference between a medical deductible and member out of pocket maximum? So,
Yep. Yep. So your deductible is going to be what needs to be satisfied first before your
okay.
insurance pays anything. So at the beginning of the year, everything really gets applied to your deductible, especially if your plan runs on a calendar year. So you go to the doctors in January, you're going to get a bill. And your out of pocket max is what throughout the course of the year, your insurance thinks you're going to have to pay, which could be that $5,000 and your deductible's 2,000. So after the 2,000, your co-insurance kicks in for that last 3,000 amount that gets you to that $5,000 out of pocket max. So deductible fully your responsibility, and then co-insurance is typically 20% of each cost, which then all goes towards that out of pocket max.
Okay. Thank you.
I hope I explained that well. I know it can seem foreign, if you're not living in it. Yeah.
So Jen, thinking about our patient population that we serve, and we are always saying that they should get a second opinion.
Mm.
So from an insurance perspective, how does that actually work? You know,
So
we
I,
don't.
yeah, so this is what I would suggest. I know that everybody's at different stages of being technologically savvy. But what I can say is a lot of insurances have spent a lot of time and money on making their apps really user friendly and sometimes even more user friendly than their websites. And there's a feature probably on every single one of your insurance apps that says find a provider. And so if you were going to seek a second opinion, you could type into that, a neurosurgeon or whatever it is that you might be looking for, and they're going to show you your in network options first. And they might only show you your in network options. So that is a good tool. And if not, the website. And then if not, you could always pick up the phone and call your
Absolutely.
insurance too. Mm-hmm.
Absolutely. Yeah. This is a personal thing. I was seeking a second opinion and I was kind of shocked at the sticker shock,
Yeah.
the dollars that were required for my second opinion. I'm like, oh, I thought I was entitled to that, from an insurance perspective, health insurance perspective.
Yeah. And again, I think that might just be tied to specific plans, like yeah, what is covered, who you're seeing, how it's coming about. Yeah.
Yeah. And I will say, I have seen more and more restrictions within health insurance policies for second opinions, right?
Mhm.
But what I have seen is a expansion on telehealth
Yes.
second opinion. So that means, they've already been given access to your health insurance records, your procedures, your, all of this,
Hmm.
and they're spending time reviewing them, and then they will meet with you depending on. This is the other thing with healthcare providers related to telehealth.
Hmm.
There are some rules related to different states and going out of state for different, but
Absolutely. Yep.
having said that, in the brain cancer space, we can help you with access to different specialists, even if they're out of whatever state that you're located in. So there are ways to do that. If if
Mhm.
the if the health if the provider and who they work for hasn't invested in their specific licenses that you have to get for each state, et cetera,
Yep.
to provide the ability to talk to patients outside of the state where the physician
Yep.
practices or the state where the patient resides. But there
Hmm.
are some ways to get around that too, just so you know, everyone. So just let us help you,
Hmm.
please. That kind of thing. So that'd be great.
That's a good point that you brought up. Absolutely. Yeah. There can be challenges, but you can navigate them. Yep.
You can navigate them. And we're lucky enough as an organization that's been doing this for over 23 years that we're able to call upon these specialists and, on behalf of patients, kind of argue their case, so to
Mhm.
speak, so that they do get a second opinion. So this is really, really great. Thank you, Jen, so very, very much. Really
You're welcome.
appreciate it. Okay, so before we go on, are there any questions that we should address before we go on and hear from Shreya, the End Brain Cancer Initiative's patient navigator and clinical trial coordinator? Nope. Okay, Shreya, you have the floor. I wondered, Shreya, is it possible for you to put up on the screen? We have a list of the next Optune open houses that are happening. We'd love to put that up on the screen if we could. And if any of you are in a city somewhere in the United States where you notice there is an open house happening for the Optune Gio device and community, feel free. I think you just have to register. Look,
Yeah.
there's one happening really soon, November 18 in Dublin, Ohio. And then we've got December 4th, there is one in St. Louis, and there's one in Charleston. So that's really fantastic. I think it's really important. Bryan started out today talking about community and teamwork. And, we're all kind of navigating this together, which means we all can help each other as well. And so within these open houses, you not only can go and learn, but you can go and you can meet other people within the brain tumor community as well. So it's kind of just wanted to make sure we highlighted that for everyone. Okay, Shreya, you were up.
Mm-hmm. And then also Optune webinars, Optune Gio webinars, they happen every second and fourth Thursdays of the month. So I on this side, on the right side, you'll see this pamphlet, I guess. They have a QR code. I'll also send this out to everyone who registered for this event. So you guys will have this information as well. So yeah, so if you are interested in joining the webinar, you can attend. So
Wonderful. Thank you.
Yes.
The second and fourth Thursday of every month. That's great.
Mhm.
That's fabulous.
Yeah. Let me go back one slide. So I wanted to take some time and just share our Caregiver Resource Center. So in this resource center, we have, some information about family caregiving. We have books, videos, podcasts. We have information about mental health, financial and some legal issue topics. And we have some, information about technology for caregivers. Technologies are like applications, so apps that keeps caregivers and patients organized, so that keeps track of like maybe appointments that you have to go to, or some other schedules for your patient, and also some ideas for legacy projects as well. So let me stop sharing, and then I will show where in the website you can find these resources. So in our resources tab, if you scroll down, this is where the Caregiver Resource Center is located. So this is our Caregiver Resources page. So this is where you'll find all the information that I just briefly mentioned. And if there are any resources that you think we should include in this page, feel free to just, email it to me. I'll share my email address, and, you'll have my phone number as well. So call, text, and I'll, make sure to include this information into this page.
And Shreya, we should also say to our audience as well that if they're searching for a resource on our website and they're not finding it, that they should definitely have a talk with us. They should talk to you, Shreya, because you will research, and you will locate resources that they are seeking out and give them. That is something you do all the time.
Yes.
So be sure, I want to make sure everyone knows that Shreya, SHREYA at endbraincancer.org, she can definitely help you with resources.
Yes. Yeah. I just want to share one more thing real quick. I wanted to share this form with you guys. This is our health insurance navigator form. So Jen, talked about insurance 101 with you. So if you guys have any questions about insurance, and you want to get in touch with her, or you just want to fill out this form, and you can set up an appointment or talk with her and get your questions answered, get more information about some, insurance questions that you may have. So for that, you just have to go under Patients and Health Insurance Navigator Advocate title, and then that's where you'll find the form that you can fill out to get connected with Jen. So I'll stop share, and then
Thank you.
Yeah. So yeah, my email address is shreya@endbraincancer.org. And I will, if you are looking for any information, Dellann shared our medical advisory board earlier today. I help you connect with any of the specialists for second opinions, I will help you find any resources you are looking for, some, eligible, suitable clinical trials for you. So yeah, just whatever resources you are looking for, I will help you to try to find what are the next steps, what is the process to get you to that goal. So
Absolutely.
just reach out to me and we'll work it together. So
Thank you, Shreya.
mhm.
And I also want to add also today, our talk, our webinar, it is being videotaped. And so from it, we will create a disease educational video and also some smaller videos for each presentation. And those will pop up on our website and also our resource section. But we will utilize our social media team and our digital media team to also get them way out throughout the year. And of course, we're in November, and November is National Caregiver Awareness Month. So it's the perfect time for us to host this webinar along with our sponsors and to be able to be here for a resource for you. So thank you. Okay, Shreya, is that all you're going to share with us today?
Yes.
Yeah. Okay.
Mhm.
Super good. All right. So that's me, and that's my contact information. And I don't even remember if I introduced myself at the beginning, but it's okay. Don't worry about it. You know how to get a hold of me. At the very beginning of the hour, I was talking about how we partner with patients and caregivers and families and healthcare providers and how we partner with industry as well. And so we talked early on about our sponsorship for this particular webinar with Novacure, as well as with Great Purpose Productions and WIM Social, in order to get the word out, right? In order to expand the disease education. Right now, there is a patient population out there who are being diagnosed with something called PCNSL. So that's primary central nervous system lymphoma. So it is cancer in your central nervous system, and it also is in your brain. And so there we have taken on the challenge of educating the PCNSL patient population about a particular clinical trial that is being sponsored by Curis, Curis Therapeutics. And I bring it up because it's really hard to get to this patient population. This is a super, super ultra rare disease. There's only 1,500 new cases in the United States every single year. So we're taking every opportunity we possibly can to tell people about their Take Aim clinical trial. And we frankly are educating patients and caregivers and family members and healthcare providers about this particular clinical trial. So the population, you think glioblastoma is rare, right? This patient population is ultra rare. So I wanted to bring this to everyone's attention in case there's somebody in your world that has been diagnosed with PCNSL. They can get a hold of the End Brain Cancer Initiative and they can learn more about this particular clinical trial. And we can pre-qualify them for this clinical trial. We can connect them directly to the principal investigator for this trial or the site in the United States that is closest to wherever they live related to this clinical trial. So we just want to get the word out. This is a patient population that, to be honest, there is no standard of care for. And so we really need to help these patients understand there are clinical trials out there for them to participate in if they have a PCNSL diagnosis. So that's all I wanted to say about that today. And then I mentioned you probably were going to hear about 3 times today about, hey, support our work. Please do. Please donate to us. It's Q4, which is fundraising time, and Giving Tuesday is coming up. And this is a great way just to help the End Brain Cancer Initiative. Much of our work is not supported, and all of our services and programs are free to patients and families and caregivers. and we want to expand those programs. We actually need to expand our programming staff because so many people need our help, which is great. Fantastic. But it takes dollars to do that. So we always ask if everybody can send in $50. That will actually support 1 hour, which is what it takes to do a formal intake with a patient or a caregiver with our patient navigator or our clinical trial coordinator. So that's that. And again, I do want to say thank you to our longtime sponsor of this particular webinar series, NovoCure. Thank you so much. You are so appreciated, not only by us, but by the brain tumor patient population, frankly, the cancer patient population. And congratulations to moving into also different disease states within cancer using TTF field technology. So thank you. And we want to say thank you to Great Purpose Productions and WIM Social and all of our individual donors who help keep our programs going and our lights on within our National Patient Services and Support Center. If there are any questions, please let us know right now. Type them in your chat. And if not, what you have on your screen, our phone number to us, you have our website to reach us. We also have a general email that reaches all the right people within our organization, and that is wecare@endbraincancer.org. So again, thank you to all of you for joining us. I want to say thank you to caregivers specifically, because we do recognize how important your job is. And we recognize it might not be a job that you chose, but we do thank you and we do recognize how hard it is. And we thank you for taking on the gift of caregiving. It's hard. I know it is, but it is also a gift. So thank you so much for all that you do for your loved ones and the patients you are serving. Thank you. And it looks like we are in good shape. Thank you so much for joining us. And we will work on getting today's webinar turned into videos and disease educational videos, and we'll circulate those out and we'll stick them on our website as well. And they will become another resource for all of you to utilize. Thank you so much.